All right, by my watch, it's 2 minutes after 11, so we'll go ahead and begin. Good morning, everyone, and welcome to Telehealth at the Crossroads. Thank you all for joining us. We're very happy to have you with us today. My name is Cameron Onks. I'm Director for Innovations in Health Technology at the F. Marie Hall Institute for Rural and Community Health. And today I have the privilege of introducing today's webinar, as well as the speakers who will be hearing from. As you know, TEXLA has hosted an in-person conference for a number of years. However, due to the public health emergency and the needs for social distancing, that in-person conference has been substituted for a weekly webinar series, which occurs every Thursday at this time, and which we colloquially refer to as Telehealth Thursday. So, for the same reason that we have to have this webinar at a distance, the use of telehealth and telemedicine has rapidly increased, and TEXLA has been working tirelessly to bring you the latest information related to telehealth policy, reimbursement, and technology. It seems like I'm having some issues with audio from the chat that I'm seeing, so I'll try and speak slowly and clear. Before we begin today's presentation, a bit about the TEXLA TRC. TEXLA is federally funded through the Health Resources and Services Administration to provide technical assistance, education, and support in regards to telehealth to all of Texas and Louisiana. To do this, TEXLA partners with Well Ahead Louisiana, which is a subsidiary of the Louisiana Department of Health. TEXLA carries out the activities for technical assistance and education for telehealth through a partnership between the F. Marie Hall Institute for Rural and Community Health at Texas Tech University Health Sciences Center and Well Ahead Louisiana. I'm going to try muting my mic and then turning it back on to see if that helps with the mute. Becky, could you please share your screen again? TEXLA TRC is a member of the National Consortium of Telehealth Resource Centers, which was formed in 2017 in order to share efficiencies and resources with regard to technical assistance for not just Texas and Louisiana, but for the entire United States. The TEXLA Telehealth Resource Center is happy to be a member of this partnership. And through this consortium, the TRCs have been able to leverage their resources and provide cutting-edge and state-of-the-science information for healthcare organizations and providers throughout the country. Today, we'll be discussing one of the most rapidly changing and most important subjects within telehealth and telemedicine, which is telehealth reimbursement policy. Joining us to discuss telehealth reimbursement policy today will be Carmen Irwin, Danae Hebert, and Becky Bound. Carmen Irwin will begin today's webinar with a discussion of CMS reimbursement policy. Ms. Irwin is a health insurance specialist and rural health coordinator with CMS's Dallas office and has worked with Medicare for the past 24 years, beginning her career in the anti-fraud department of Medicare contractor before moving to beneficiary outreach and education, and in the fall of 2002, joining the Dallas CMS office. In 2016, Carmen became the rural health coordinator for both program integrity and Medicare policy. Also joining us today will be Danae Hebert to discuss Louisiana Medicaid policy. Ms. Hebert is the Healthcare Innovation Manager for Well Ahead Louisiana, which is a chronic disease prevention and healthcare access initiative of the Louisiana Department of Health. In this role, Danae serves as the coordinator and primary point of contact for telehealth and Project ECHO initiatives within the Bureau of Chronic Disease Prevention and Health Promotion, as well as the liaison for Louisiana for the TxLA Telehealth Resource Center. Prior to joining TxLA, Ms. Ada worked for 6 years in hospital corporate compliance, specializing in hospital licensure and promoting interoperability. Finally, we will be joined today by TxLA's own Becky Bounds. Ms. Bounds is the driving force and program manager for the TxLA Telehealth Resource Center. She's earned her master's in nursing from TQHSC, and in addition to her work with TxLA, she has clinical nursing experience in a variety of settings, 18 years experience in ambulatory healthcare quality, compliance, and informatics, and is now dedicated to promoting telehealth and telemedicine, particularly in rural and underserved areas. Becky holds certifications in informatics nursing and healthcare quality, and we're very happy to have each of our speakers with us today. Finally, some housekeeping. Q&A needs to be submitted through the chat. Please ensure that all of your mics are muted. This webinar is being recorded and will be shared on the TxLA website, and you can watch our website for updates on this presentation as well as future presentations that take place. With that, we'll turn it over to our speakers for today, and thank you all for joining us.
Well, good afternoon. My name is Carmen Irwin. As it was stated, I'm with CMS in the Dallas Regional Office. Inviting us to come speak with you guys, or you all today or this afternoon. I'm just going to go through a couple of slides that discuss how CMS's policy changes with regards to this public emergency changed how we are paying and currently the different flexibilities that have been initiated due to the pandemic for telehealth services within CMS. I apologize. Next. Okay, just a quick quote I thought was interesting, and I wanted to put it out there. As you can see, often when we think we're at the end of something, you're at the beginning of something else, and I don't think anything could be more true than what is going on right now in the country with the pandemic, COVID-19, and telehealth services. One of the things that occurred little Nothing like technology to get your day going. We'll get the slides caught up here. But basically what I wanted to discuss is, as of March 13th, when the outbreak began and it was initiated by the federal government with regards to the proclamation declaring a national emergency concerning the novel COVID-19, flexibilities were put in place by the federal government. Those flexibilities occurred, and we had changes that occurred from March until the present day. One of those being, of course, how Medicare instituted telehealth. Basically, Medicare had limitations. We were limited on who could provide telehealth, where the beneficiary could reside, and how telehealth was actually initiated in the Medicare program. That being said, several different measures were put in place due to the COVID-19 public health emergency. Some of those being the HIPAA flexibility during COVID-19, which was the public emergency, telehealth waivers for patients enrolled in Medicare, the flexibilities for federally qualified health centers and rural health clinics, and of course, cost sharing. All these flexibilities together created what we're doing now with regards to payment for telehealth. The one key would be that Medicare is looking at this. We currently have these flexibilities and the authority of these flexibilities due to the public health emergency. Now, we are already looking forward to what's going to happen once this public health emergency, God willing, becomes hopefully not a pandemic and we can control it. But where do we go? We know that telehealth is being used by the majority of our providers and receiving this by our beneficiaries, both through our fee-for-service and of course our Medicare Advantage. Just to give you some added information, recently the administrator, Seema Verma, published in a blog in Health Affairs regarding where Medicare or the early impacts of telehealth and where we see this going. Just to give you some background information, prior to COVID-19, 13,000 Medicare beneficiaries received services through telehealth. As of April of 2020, that number is at 1.7 million. Now, we know it can be done on a vast expanse, as you all have seen and where we're going, but these are just some of the things that we're looking at from the perspective of telehealth and expanding or providing those flexibilities. Some of the big changes with telehealth, of course, is the audiovisual component. What Medicare put into place with regards to HIPAA flexibilities, how we're doing it through FaceTime on Apple items or Facebook Messenger, Google, Zoom, Skype, what we're using today with regards to those audiovisual. In addition, there was expansion of what Medicare could do with Medicare has published a list of those telehealth codes that are billable. In addition, we have out there on our website a graph that identifies which of those services have to be conducted through both audio and visual, and which of those services are just audio. So with that being said, we're going forward. We're looking at how we can expand and provide or pay for these services that our Medicare providers are giving to our Medicare beneficiaries. We know in the past, Medicare was very limited on who could receive it, where those services were provided, and of course, the provider type that could offer those services. With the CARES Act, it got expanded, or telehealth was expanded to both FQHCs, RHCs, and again, Medicare paying for these services with beneficiaries in their home and other places of service that were not payable previously. As we go forward and as we're looking at these flexibilities, we as an agency are looking to see where we go from here. Will those flexibilities continue? I don't have that information at this time, But we're hoping that with the data that's being collected in the services, we're seeing where we can go to next. You know, often or can we continue with these services that are providing? Sorry, we're just getting the slides caught up here. Where these services go to next. So let's talk a little bit about telehealth waivers and the patients enrolled in Medicare. Medicare has done a great job, I believe, with putting information out there for telehealth services and where we can go with regards to providing services to Medicare beneficiaries, making sure that they understand where these services can be accessed. Oh, we're catching up here, I believe, and I apologize. Okay, I think again, my apologies. Here we go. Where these patients can receive the services, how they can receive them, making sure patients understand. There's a telehealth website out on the HHS that is telehealth.hhs.gov. It explains all this information to providers, but also our beneficiaries. We know that with our providers, the billing and what we're talking about today, how to bill those claims, how to get payment for the services they are providing is very crucial in this time. But it's also crucial that we make sure that our beneficiaries or caregivers understand that it's okay that they be in their homes, that they receive these services. What are the platforms in which Medicare is going to pay for the provider to reach out to them? Some of the changes were that it could be a brand new visit with a physician. It doesn't have to be that established relationship with a physician. All these changes or flexibilities, not only are they a lot for a provider to understand and to work through, but also our beneficiaries understanding that this is okay, that they should work with their providers, that they understand how that telehealth is going to help them receive care from the Medicare perspective. Some of the other things we're looking at with regards to the expansion and how we're paying for telehealth is, of course, making sure that we identify those services, as I did before, that are listed under the Medicare guidelines that are payable. How are they payable? Working with our Medicare administrative contractors, or our MACs. For those of you listening today in Texas and Louisiana, that would be Novitas, who is the Medicare administrative contractor. Making sure that we're opening those lines of communication to understand, how do I bill this? Am I billing it correctly? So that those claims continue, your reimbursement continue, which is key for all of you under this current situation, and making sure that we're educating from a Medicare's perspective, from CMS, and you understand what we're doing, how those claims should come in, and making sure that that line of communication is open. One of the other items discussed with regards to the flexibilities under the telehealth expansion is, of course, where do I go for guidance? How do I see, or how do I get this information? Several websites have been placed in several links, and I'm going to get to those now, with regards to policy changes. We know initially in March, when the public health emergency was instituted, there was a lot of confusion. There was a lot of information coming out very quickly, and it was hard to keep up with that. As you can see, we provided you with some links. The Medicare coverage and payment for virtual services is out there, the list of telehealth services. At this point, that's to date. However, as we continue down this road, the public health emergency, there may be changes or services or HCPCS codes or CPT codes that are added to that list. And that is something that I would urge you to visit, to make sure as a provider you're aware of what those services are and how they and what requirements are attached to those. 19 telehealth coverage policies, which were instituted under the current emergencies tab on cms.gov. And then we have a varied list of Medicare telehealth frequently asked questions, and that is listed on our website. In addition, we have the emergency declaration blanket waivers, or the 1135 waivers that were instituted by CMS. And then the corona waivers and flexibilities under the CMS guidelines. We have blanket waivers, and then we have additional waivers that are put in place based on policy and authority given to us under this public health emergency. So here are just some of the links that you can access to get further information as a provider for Medicare with regards to using telehealth as a service to provide healthcare to our Medicare beneficiaries. On the next slide, basically what we're looking at is just a breakdown general telehealth policies. And I apologize, it is kind of small, but it's a really good, I think, side-by-side identifier. Policy during COVID-19 for our providers, and then of course policies for FQHCs. It has geographic site and location, and as we know, that flexibility has taken away those borders or those guidelines. There are no geographic restrictions. The patients are allowed to be in their home during telehealth interactions. And then of course the location of the provider. Again, we discussed this. A provider is able to provide services when at home or somewhere that they're outside of a facility or a clinic. That information is out there. And then of course the key part of this is the modality. How do I get paid for telehealth with regards to Medicare? And there are some limitations, but again, this information is provided on the website, cms.gov, and out on the current emergency listserv for telehealth services. The type of provider, and as we know for RHCs and FQHCs, Section 3704 of the CARES Act expanded that availability to our FQHCs and our RHCs. And then of course the services, the actual codes. There's 180 different codes that are available currently on that list. The amount of the reimbursement, depending on the type of provider, what you're going to get paid. As far as a face-to-face, if it were a visit, telehealth is pretty much the same with regards to this. And of course, how do I bill it? There's just a very brief descriptors. Now I say this because this is a very small snapshot of how telehealth is payable under Medicare. If you have specific questions or you feel as though you have some discrepancy in submitting a claim, I would first venture to go to the MAC, the Medicare Administrative Contractor, which is Novitas. If you feel as though you're still confused or have some questions with regard to what the MAC has provided you, you can always reach out to us here at the regional office, and I will provide you my direct contact information. But I would urge you initially to go to your MAC, work with the Medicare Administrative Contractor when you're submitting that claim, or if you have questions with regard to that claim regarding the telehealth services that you're providing. I know initially it's very brief. I would urge you to look at the telehealth services, the website, www.telehealth.hhs.gov. It has a lot of information. And then, of course, on the CMS website, the current emergencies that's listed. There's several different websites, several different levels of information. And again, there's all the flexibilities that have currently been put in place for this public health emergency. As you can see, that is my direct contact. I am the contact here in the Dallas Regional Office for the 5 states we cover: Texas, Louisiana, Oklahoma, Arkansas, and New Mexico. Please feel free to reach out to me. I may not know the answer, but I'll definitely try to get you the answer. Once again, I thank you guys, and I'm going to kick it over to our next speaker. Thank you.
Thank you, Carmen. Good morning, everyone. As was previously mentioned, I'm Danae Aber. I'm the Healthcare Innovation Manager at Wellhead, Louisiana, which is the Bureau of Chronic Disease Prevention and Healthcare Access under the Louisiana Department of Health. And I also serve as the Louisiana site coordinator on behalf of TextLaw. So today I will provide a very high-level overview of the changes in the waivers related to Louisiana Medicaid reimbursement for telehealth during the COVID-19 public health emergency. And then I'll also talk about the telehealth-related legislation that was addressed during the Louisiana 2020 legislative session. If I can get my slides to advance here. Okay, so first, I'd like to review the Louisiana Medicaid telehealth reimbursement rules prior to COVID. Louisiana Medicaid has been generally pretty flexible when it comes to telehealth reimbursement. The reimbursement regulations do not require the patient nor the provider to be in any particular geographic location or facility type. Generally, telehealth reimbursement was limited to interactive audio and video visits, with some limited reimbursement for remote patient monitoring in specific circumstances. The regulations did not specify or limit any particular providers who could utilize telemedicine, and Louisiana Medicaid had not published a specific list of services that were or were not covered when they were provided via telehealth. And I also do want to note Louisiana Medicaid does not reimburse the originating site fees. They only reimburse the distant site provider. So throughout the COVID-19 public health emergency, Louisiana Medicaid has issued and revised several informational bulletins providing additional guidance and flexibility around telehealth reimbursement. So during the public health emergency, Louisiana Medicaid is covering services provided via audio only or telephone when video is not immediately available at the time that it's needed. This provision has actually become more flexible throughout the emergency. When it was first issued, providers had to document that they made reasonable attempts to connect via video visit, and that they had to document why they were unable to establish a video connection. And then later in the emergency, the guidance was revised to include the words, "if not immediately available," which makes that standard a little bit looser to be able to utilize that audio only visit. In one of the first informational bulletins, Louisiana Medicaid specifically noted that any services that are generally covered by Medicaid when provided in person that are included in Appendix P of the CPT manual will be covered when provided via telemedicine. These services are reimbursed at the same rate as an in-person visit, including RHCs and FQHCs, which receive their all-inclusive or their PPS rate. As far as I'm aware, this is the first time this informational bulletin was the first time that Louisiana Medicaid actually put in writing this reference to Appendix P of the CPT manual as the list of covered telehealth services. But I do want to note that this reference doesn't specifically state that Medicaid or the managed care organizations don't or can't cover services in addition to those in Appendix P. But it does imply that Medicaid and the MCOs are not required to cover services provided via telehealth that are not on that list. Therefore, providers who want to utilize telehealth for services that are not on that list would have to reach out to Medicaid or the MCO directly to verify coverage. Later on in the public health emergency, Louisiana Medicaid also issued additional bulletins that allowed for the provision of teledentistry and early periodic screening, diagnostic, and treatment preventative services for members that are older than 24 months. These services are somewhat limited and they're reimbursed at a slightly lower rate than the in-person visits. They've also issued some informational bulletins specific to behavioral health, mental health, and substance use disorder services that provide some additional guidance, including extensions of prior authorization timeframes. There are a couple of these waivers, such as the prior authorization extension, that have a specific date listed that waiver ends. However, most of the changes that are noted are in effect through the end of the public health emergency. Governor Edwards continues to extend the public health emergency declaration. At this time, it's in place through Friday, July 24th. With the current state of COVID-19 and the trend in Louisiana, we do anticipate that this date will likely be extended again. So we can move to the next slide. So moving on to legislation, we had several House bills and one Senate bill proposed that were related to telehealth. A couple of them were purposefully redundant and proposed as a backup in case the other bill with similar information did not pass. So these are the list of the bills that were proposed. HB 449 is related to behavioral health services and specifically examinations for issuing emergency certificates via telehealth. HB 530 and 553 were both related to remote patient monitoring. HB 589 is related to Medicaid policies and procedures. And SB 98 would add Louisiana to the Audiology and Speech Language Pathology Interstate Compact for licensure. So HB 449, 530, and 589 were passed and signed by the governor. So I'll provide more detail on those bills specifically. So HB 449 was passed and signed and will become effective on August 1st. It amends a couple of statutes to add the words including behavioral telehealth services to the definition of telehealth in these statutes. It also amends the admission by emergency certificate statute to allow for psychiatric mental health nurse practitioners, in addition to psychiatrists, to conduct examinations via telehealth that are required to issue the emergency certificate. HB 530 will be effective on January 1st. It requires issuers of healthcare coverage plans to display, quote, in a conspicuous manner on their website information regarding how to receive covered telehealth medical services, telehealth healthcare services, and remote patient monitoring services. This rule also outlines the following conditions for reimbursement for remote patient monitoring. The service must consist of assessment, problem identification, and evaluation, and it goes into some more detail about what that entails. And then it also requires that the entity providing remote patient monitoring services must have protocols in place to address several items, including authentication and authorization of users, monitoring, tracking, and communication with the prescribing healthcare provider, system security and integrity, and things along those lines. And then finally, HB 589 was passed and signed and will be effective on August 1st. This act requires Medicaid to periodically review its policies regarding reimbursement for telehealth services to identify variations between permissible reimbursement under Medicaid versus the reimbursement available under Medicare. And it allows Louisiana Medicaid to modify its rules, policies, and procedures related to telehealth reimbursement as necessary to provide reimbursement that is comparable to Medicare reimbursement. It also directs Medicaid to include in its policies and procedures three things. First, an exhaustive list of covered healthcare services that may be furnished via telehealth. Two, processes by which providers may submit claims for reimbursement for services that are furnished via telehealth. And then 3, the conditions under which a managed care organization may reimburse providers that are located out of the state of Louisiana and they provide services to their enrollees in Louisiana. So we will definitely be on the lookout for Medicaid's response to this act. And we're looking forward to what we hope will be an extensive list of covered health services from Medicaid. And with that, I will pass it to Becky for Texas updates.
Hello, we'll talk a little bit about Texas Medicaid now. I see, and there are some ways that Texas and Louisiana have followed a similar path with some of our legislation. So pre-COVID, Texas Medicaid, I'm going to talk a little bit about what the rules were already, and I guess it's an editorial comment, but Texas really has become very telemedicine friendly in the last couple of years. For the location of the patient, there is no requirement. The patient can be in their home, and that was pre-COVID. And the provider can be any place, and so that's the picture. Imagine the provider on the beach, let's say. The patient's home is an acceptable originating site. The technology, Texas Medicaid will pay for interactive audio video, store and forward, and remote patient monitoring. And there are some specific diagnoses that apply to remote patient monitoring. There is a list of providers. There was an existing list of providers who may provide telehealth services and bill for telehealth for Texas Medicaid. And there's the list there, and I won't go over every one of those. Now, occupational therapy and speech therapy was fairly recent that they were added in 2019 for some programs, special needs programs in schools. And then there are a specific list of codes that Texas Medicaid will cover, and I will give you the best resource for that on another slide. So during the COVID public health emergency, Texas Medicaid did allow for some waivers. So again, no restriction on location of patient and provider, that was existing. But what they did add is this coverage for audio only when video is not available. The difference in the audio only codes for CMS or Medicare and for Texas Medicaid is that Texas Medicaid is allowing you to bill the in-person codes, CPT codes, for phone only. And I'll give examples of that in just a minute. For providers, what was added specifically was we have QHCs and RHC providers, though there was some coverage previously. And then physical therapy, occupational therapy, and speech therapy and have been added specifically. And these are groups that have been very active in wanting to do telehealth during the public health emergency. I've had a lot of conversations with therapists. And then there are the specific codes that are indicated. So the Texas COVID response, we did have the emergency rule initiated, and it directed insurers and health maintenance organizations to pay in-network health professionals at least the same rate for telemedicine services as in person, including mental health. Cover telemedicine services using any platform permitted by state law. And we can talk more about that. Previously, some of the managed care organizations would say, if they were called to ask if they cover telehealth services, they would say yes, and we are contracted with this national telehealth provider to do so. But Texas before and during COVID response said, no, the provider who's in network with that insurer needs to be able to use their own platform and not just the national provider for services. And they can't require any more documentation for telemedicine services than in-person services. So here is the telephone only medical services. These are different codes than CMS requires, but these are, this is an example, the 99201 to 99215 are CPT codes you generally see used in a clinic. let's say you can use those codes for phone only in Texas, for Texas Medicaid. You can use telephone only for behavioral health services. And something very new during the COVID response was well child visits via telemedicine if the child is more than 24 months of age. Previously, well child visits have not been covered via telemedicine. CHIP payments are not required for covered services via telemedicine, so you can waive CHIP or Medicaid copay. The latest update that we got was the Texas Department of Insurance extended the requirement that insurers pay telemedicine services, including mental health, the same as in-person visits. So this took effect March 17th, but it has now been extended through September 12th. What we've also found is on July 11th, Texas did extend the public health emergency for the state. This is your best resource for Texas Medicaid and all of the policies and everything that I gave you, including the specific list of codes that they will cover, the providers they will cover, what is defined as telehealth or telemedicine, remote patient monitoring, every service that Texas Medicaid provides. This is a very extensive resource. The basic billing model, and this includes Louisiana and Texas, is the CPT code that you would use if the patient were there in person with a 02 place of service and a 95 modifier. And it should be paid again at the same rate as in-person services. I want to mention a little bit about parity law, and this is existing, and this map is existing pre-COVID, but many states have a parity law which says if it's telehealth service, you shouldn't deny it because it was provided in that way and not in person. Some parity laws are stronger. Louisiana has had a parity law for a while that said it should be that these services should be paid at the same rate and to the same extent as an in-person service. Texas also beefed up the language around Texas Medicaid to say essentially the same in the last year. So as far as Texas legislation, we are on a different, the Texas legislature meets every 2 years, and that will be in 2021. So, so we're on a different calendar than Louisiana, but I wanted to talk a little bit about some laws that were passed in 2019 to show you that this is pre-COVID, and that Texas has been on a trajectory of addressing telemedicine in a lot of different areas because our legislators see it as a way to meet some of the underserved needs in our state. So Senate Bill 670 requires Medicaid to cover telemedicine services. This is the one that strengthened the language of our parity law to cover Texas Medicaid, that they should cover telemedicine services. House Bill 1063 added some pediatric conditions to our remote patient monitoring regulations. Before, the patient needed to have a diagnosis of hypertension or diabetes, and it requires a pre-authorization for remote patient monitoring, but there are some PD conditions added. For House Bill 3345, again, this is pre-COVID, where they're saying physicians should be able to choose their platform rather than the health plan dictating what platform they use. Then telehealth treatment for substance abuse with House Bill 3285. Senate Bill 749 allows on-call physicians to use telemedicine. House Bill 871 allows telemedicine in rural counties and communities so that they can use it for an on-call emergency medicine physician. And then House Bill 1960 created a Governor's Broadband Development Council. We recognize that we still have a lot of underserved areas that are extremely rural and remote and may not have sufficient broadband for their needs. This is not an exhaustive list of everything telemedicine related from last year, but just to give you an idea. Here is our contact information. This is me, becky.bounds@ttuhsc.edu, and then the Texla email also comes to me, and then Danae, who just spoke with you, abear@la.gov, and here is our website. Here is the website for the National Consortium of Telehealth Resource Centers. If you go here, there are a wealth of resources there, including free webinars on a monthly basis that we host. And if you scroll down a little bit, you see a map with all of the telehealth resource centers, and you can click by state to find who you would like to contact. So for next week, I want to tell you that we have the next installment of our summer webinar series will be Finding and Vetting the Service of the Perfect Service Provider. And this is designed for those maybe rural areas that are looking for someone to provide telestroke or any other kind of service via telemedicine, and you're looking for one of those large providers to provide those services. And so this gives us detail about how to choose those service providers. Okay. I'm going to go to Texla Telehealth, texlatrc.org, I'm sorry, and click on the banner that says Telehealth at the Crossroads, and it will lead you to all of the other sessions that you can click on and register individually. So I'm going to go to some questions. One question said, at some point, will wound care be covered via telehealth? I think I don't have an answer for you right now, but unless someone else, I'll put that out there, and if Carmen and Danae have some answer for that, I would say contact us and we will look up more information on that. Does condition code DR, defining a disaster-related claim covered by the blanket waivers, apply to FQHC, telehealth, and telemedicine claims? So Carmen is shaking her head.
I'm off of mute now. Just to let you know, for those particular claims, I showed on the graph on my slides, it was DR code. However, I do want to make sure there is a Medicare Learning or MLN article out on the CMS specific to CR and DR codes, and there's a graph that shows what claims specifically need to have those. So that is MLN, S as in Sam, E as in Edward, 20011.
Thank you. Okay, and Dr. Phillips, I would like to know if the speakers think the modifications of the telemedicine rules for claim payment will continue past the COVID pandemic. Carmen, would you like to weigh in on that one?
I don't know. I just don't know. If, you know, we'll have to see how and what happens after the public health emergency and where CMS goes with those items.
I do know right now there is a lot of activity around changing the rules to keeping these loosened rules in place past the pandemic. A number of professional organizations have written to the legislatures and CMS asking that those waivers continue. Can Carmen's slides be shared? We will have a recording of the of this session. And yes, we have slides that that can be shared, please email. Next question, is Louisiana considering coverage for storing forward technology?
Hi, I have not seen any movement specifically around store and forward. So like we saw on the list, there was no specific legislation proposed, and I haven't really heard anyone talking a whole lot about store and forward technology. There seems to be more attention around remote patient monitoring at this time.
Okay. Any other questions?
Hey, Becky, this is Dr. Santos. I would like to thank you, Carmen and Danae, for the excellent presentation on complex and dynamic topic of reimbursement in telehealth and telemedicine. I would just like to ask, what do you think, or how do you think the Medicare and Medicaid reimbursement compared to commercial reimbursement right now? Is it, pretty much the same, or, it seems like Medicare and Medicaid seems to be the leader and seems to be the commercial is following, or is it the other way around?
So what we can say is a lot of the waivers and flexibilities around COVID for CMS and at the states have to do with directing those commercial payers to pay it. So I think that's really significant that we've seen that language federally and from state to state. So that's the good news in this. So if there are no other questions or comments, we will, let me check one more time. Okay, I think we have covered all the questions. If you have other questions, please don't hesitate to contact us. If you didn't get our contact information, you can go through TxLA.org, and there is a place to click contact us, and we will get an email. And thank you so much for joining us, and join us next week for finding and vetting the perfect service provider. And we will close out for today.
Thank you.